Clinical research has shown repeatedly that MDMA-assisted psychotherapy is a very powerful treatment for resolution of PTSD. Currently, there's not a lot of clinical research on MDMA for substance abuse. However, we know the iboga plant is highly efficacious for substance abuse and addiction. However, that said, it's been my experience that MDMA-assisted therapy can be very effective for resolving addiction-related issues if, and this is a big if the client is really ready to quit using a substance. This medicine also tends to be effective for ADHD. Individuals with ADHD tend to feel cut off from other people because their attention and memory issues are perceived by others as a lack of interest. When we struggle with any mental or emotional issue, we often feel cut off from others because we are so hyper-focused on our own symptoms and our own suffering. After working with this medicine, clients with ADHD often report finding it easier to focus, their memory gets better, and they feel more emotionally accessible. A big part of this process is feeling safe in their own body and learning how to ground and anchor, which allows them to be more present in their life. This medicine can also be a powerful treatment for certain phobias because it allows for the fleshing out of deep-rooted fears relatively easily. Simple phobias can often be resolved in just one session once the client understands the symbolic meaning behind their phobia. PTSD is no longer just an issue suffered by combat veterans. PTS is seen in a wide range of people today. Post-traumatic stress disorder is an anxiety-related issue that stems from an extremely traumatic event or events such as combat, physical, emotional, or sexual assault, victims of torture or kidnapping, and even disasters. Clinical research has shown repeatedly that MDMA-assisted psychotherapy is a very powerful treatment for resolution of PTSD. As I stated previously, MDMA allows individuals to revisit past trauma and adverse memories without debilitating fear, which allows them to work through their past in a non-threatening context. MDMA is very much like a mirror or a microscope that allows individuals to honestly examine their emotional history, their current level of function, and the cause for any adverse behavior. There is so much evidence that shows breakthrough MDMA-assisted therapy sessions minimize defensiveness, paranoia, fear, and enhance insight into the causes for adverse behavioral issues and even psychological or physiological illnesses. In this sense, MDMA strengthens the mind-body connection and assists in healing physiological issues. Approximately 25% of victims of crimes display symptoms of PTSD. This percentage rises dramatically to 45–50% among victims of domestic violence and can go as high as 50 to 60% among victims of sexual assaults. Sexual assault is the most common crime against women. Current statistics estimate 15 to 25% of all women have suffered some form of sexual assault during their lives. It is my experience this statistic is significantly higher and closer to 50 to 60% in women and 25 to 35% in men. Victims of sexual assault typically go through a period of generalized negative emotions characterized by anxiety, fear, vulnerability, stress, and confusion. The probability that victims of sexual assault will exhibit post-traumatic stress disorder symptomology is extremely high. The reason being is that the majority of sexual assaults often occur in locations the victim deemed safe. The most common symptom of PTSD is generalized anxiety around locations that before the attack were considered safe by the victim. PTSD symptoms can include depression, loss of self-esteem, guilt, shame, avoidant behavior, and difficulty with interpersonal relations. Almost 80% of sexual assault victims experience all or many of these symptoms long after the assault. In truth, unless PTS is resolved, symptoms tend to continue to persist throughout one's entire life. When someone experiences sexual attack, the predominant feeling is fear for one's life. This makes them feel very vulnerable, together with feelings of disempowerment, humiliation, and shame for having been treated like an object by the attacker who ignored their feelings. An individual's dignity suffers, and shame then turns to anger. Thus, sexual assault creates a whole storm of destructive emotions. The subsequent damage to self-esteem erodes an individual's ability to effectively live an empowered life. Disassociation, repression of feelings, loss of one's voice, and avoidance are all predominant defense mechanisms. The problem is, victims of sexual assault can run, but they can't hide from themselves or from others. The numbing of feelings often follows, which increases anxiety and other psychological symptoms. Phobias, impulsive reactive behavior, depression, irritability, nervousness, insomnia, and a slew of other issues. Clinical research has demonstrated MDMA-assisted therapy decreases the fear response, which leads to a corrective emotional experience, which in turn diminishes pathological effects of previous traumatic experiences. I often hear clients say they experience the most dramatic healing benefits from MDMA-assisted therapy. Clients feel empowered again, they feel whole, and they feel complete. MDMA-assisted therapy has the unique ability to accelerate the therapeutic process. Not to mention, MDMA's therapeutic effects tend to make other therapies even more effective. MDMA allows individuals to objectively view their psychological defense mechanisms, to see what's unnecessary or no longer working for them, which allows for more openness and vulnerability. This is how emotional healing takes place. MDMA-assisted therapy creates an enhanced capacity to gain clarity and understanding of the truth. We can more easily communicate deep feelings that have often never been voiced before, so they can be processed and integrated. In doing so, individuals can more easily communicate new insights and revelations. As powerful as MDMA can be for healing, not everyone is a candidate for this particular treatment modality. There are numerous conditions that are considered concomitant, such as heart disease, high blood pressure, bipolar disorder, schizophrenia, liver disease, seizure history, diabetes, hypoglycemia, like glaucoma, hyperthyroidism, and pregnancy. Thank you for watching today. I am Dr. Michael Hofrath, and I look forward to being of service in any way that I can.